Welcome, students. We're going to continue on with our Chapter 9 PowerPoint lecture. Today, in this section, we are covering slides 41 through slides 65. Now, the first about 10 slides that we're going to look at here are image slides talking about wrapping gowns. In the last section, we were getting into sterilization methods and how we wrap our packs. So today we're going to talk a little bit more about wrapping, specifically with wrapping your gowns, with wrapping your towels. You will be doing a gown and towel pack for every personnel who's going to be sterilely scrubbing in to the surgery. Now, there are disposable gowns like the one that you see here in this picture. This is a one-time use only gown. You would open up, you would use it, and then you would throw it away after. The one that I'm going to show you in the video that I have recorded is a reusable one, where you can refold it, re-sterilize it, and reuse it. And that's pretty common, especially in general practice, to see a lot of the reusable gowns, towels, even fenestrated drapes are reusable rather than the one-time use only ones, just because it creates a lot of waste. And they're honestly pretty expensive to keep buying materials and supplies rather than just cleaning and reusing your own. So just be aware of that. The one that's in this picture, you would never be rewrapping one that's like this because it's disposable. You would be throwing it away after you're using it. But just in this PowerPoint, it has kind of step by step what it looks like to fold a gown. Now, me personally, I think it's really hard to learn from pictures, and I don't think it does that great of a job to really show the techniques and all of that. So, what I've done is, yes, there are pictures here for you. Please review them on your own time. Again, I think that it's a little confusing just looking at all these images. So, I have some videos for you. I actually have two videos that I recorded of myself when I was training some lab instructors over in Riverside. So I'm going to show you guys a video of me folding a towel and me folding a gown, just so that you guys can get a little bit better of a visual. Now, you're also going to be doing this in your labs, so you're going to get really good ample practice at this. But keep in mind that these videos can be a great resource to go back to, and you can find them in your module. They are under the videos extra course materials section. All of the videos that we go over today will be in that section, and that's standard in our modules. Any lecture videos from the PowerPoints will be there. Okay, so we're going to go into folding a towel first, and then I will show you the next video, which is folding a gown. Again, to give you a little bit better visual rather than just the photos, because I do think they're a little hard to understand. So I'll walk you through both of these, and then we'll come back to our slides after. All right, everybody, today we're going to be folding some surgical towels. All right, everybody, today we're going to be folding some surgical towels. So I'm going to show you how to fold this towel, and this is how you're going to put it into your surgical packs with your gowns, possibly if you're doing towel packs, or even if they require you to put them in their instrument packs. So with your surgical towel, you're just going to hold it all the way out, extended like it's flat, laid down on the table. You always want to make everything really smooth. You want to be as clean and clear and cut as possible, so make sure you smooth out all those wrinkles. Being a little titch of OCD is actually a little good for when we do surgical wrapping. So what you'll do is the first fold we're going to do is a hot dog fold. So you're going to take the ends of your towel and just fold this guy right in half, going long ways. And then again, I like to smooth this down. Then the next fold you're gonna do is you're gonna grab the top of the towel that you just folded over, and you're going to fold it half back towards you. So it should be a nice fold that looks like this. Then your next fold you're gonna do, I like to pinch at both ends. This side that's left here is gonna fold under. So your towel will be nice and straight, looking like so. And we also call this an accordion fold. So if I were to pick up the end here, it goes up and down like an accordion would. Now I'm also going to do that accordion fold going all the way up my towel until it's nice and a little square. So I'll start at the end here and I'll go over and under, over, under, over, under. And then if I'm a little bit uneven, you guys can see I'm a little uneven with my towel folding, that's okay. We wanna get this nice and even, so I'll just kind of go through and pull it a little bit more, even out these folds until everything is nice and even where I want it to. And you guys might have to do it a few times to really get into the swing of how you want it folded and getting it nice and even. All right, so once my fold is nice and even, you can see the last thing we're going to do, it's a nice cute little square like so. You're going to take this little tab here and you're just gonna fold it right back over so that the doctor can see that tab. How we're going to use this is once the doctor is done doing their hand wash, they're going to use this towel to dry their hands. So they're going to pick up that little tab that you just made, and if you folded the towel correctly, you should be able to pick it up and go right out like so, and it'll come right out of their fold to then be able to dry your hands. And that is how you wrap or fold a surgical towel. Okay, so that was our surgical towel. Now we're gonna go into our gown. Again, folding our gowns next, which is a lot of the images that you saw here in your PowerPoint. All right, so we'll start this one now. Okay, so now we're going to learn how to fold a surgical gown here. Okay, so now we're going to learn how to fold a surgical gown here. Now, this is a gown that's already pre-folded up, so this is what it's going to look like at the end, nice and folded up like so that we can then wrap it in our packs. So the whole point of why we wrap it this way is so that it makes it easier for the doctor or ourselves to put on this gown if we're going to sterilely scrub into surgery. So you'll see these little ties that are up here at the top of the gown. This is what the doctor or yourself is going to hold on to. We're going to grab these ties and I'm going to lift this gown up. Now, as you can see, the armpits are away and facing away from me. That means that I have the gown backwards. So not to worry, these little ties, I can seriously just switch them right over and now I'm good to go without losing any sterility or touching any non-sterile items with my gown. Then from here, I can put it on and glove. But today we're gonna fold. So how we're going to fold is I'll use a nice big table like so, and I'm going to drape my gown over the table like the table's wearing the gown. So you'll see the sleeves are right up front as if this table is putting on this gown. That's how I want it to be. So I'll kind of straighten it out first. Again, it's really good to be nice and even, get all those wrinkles and lines out. The first fold that I'm going to do is I'm going to take these sleeves here and I'm going to cross them over the center. And I like to switch, I'll walk to the other side of the table rather than just reaching over because I can just get a nicer, cleaner fold while doing this. So again, I crisscross both sleeves over. Then the next fold that I'm going to do is I'm going to grab the top of the gown and the bottom, and I'm going to fold this gown in over and in half. Now, how I know I'm folding it in half is there's a seam that runs all the way down the side of the gown and up to the armpit. So what I need to do to get this nice and straight, I'm gonna hold the tab that's down here at the end of the seam, and I'm also going to grab onto the armpit up here. I wanna make sure that I grab where the seam meets the armpit. So I'm gonna grab here, grab at the end, and I'll kind of pull and shake it out. You can see I pulled that armpit out really nice up here, so the doctor, when they open up this gown, will see the armpit and they'll know where to go. So I'll just smooth this guy out, and then I'm gonna do it exact same on the other side. So I'm going to grab the top of my gown and the bottom of my gown, fold it up and over in half. Then same thing, you see this seam that's running all the way down the side, that's your middle marker. So I'm gonna grab the end, grab up here at the armpit, kind of pull and shake it out. And then I can adjust my fold here, smooth all this out. These ties, you can just tuck them under. And again, I'll adjust my armpits, everything up here. So this is what your gown should look like if you've successfully folded it in half and the armpits are pulled out. That's very, very important. Now the next step that I'm gonna do, it's gonna start to look similar to your towel fold. I'm gonna take my gown here and fold it in half. Again, smoothing it out nice again. Then I'm gonna take the top half of my gown and fold it backwards. Then I'm going to grab this gown and put the half that's not folded, I'm gonna fold it underneath, just like what we did with that towel to get that nice accordion fold. Again, I wanna make sure to pull these armpits out, make sure that they're really nice and visible. Then I'm gonna accordion style it up. So I'll start at the bottom and I'll go over and under, over, under, over, under until my last fold up top here. And with these ties, you do want to make sure to kind of tuck them in, keep them a little bit nicer, but you do want them to be visible. Your top fold may be a little uneven, and that's okay. Your towel is going to go right on top of this, and then we will be putting it into our gown and towel pack. So that is how you fold a surgical gown. Okay. All right, so that was some good visuals again of folding your surgery towel and folding your gown. And be aware that you're going to fold the fenestrated drape the same way that you fold the towel. So kind of how it was showing doing the drape here. It's the same way as you wrapping the towel, doing that accordion method, folding technique. So with that being said, getting into kind of the last portion of talking about sterilizing all of our items and prepping them and getting them ready for our autoclave is once they're finished, right? We run them through our autoclave, whether that's the steam or the gas autoclave. We will then place it on racks to cool and dry, especially if it's been through the steam autoclave, right? Because it was exposed to really high levels of pressure and steam, so hot water. So it does need to go on racks to cool and dry. We want to make sure that we're never stacking our packs together. We should be storing them in like waterproof bins or cabinets, basically to keep the dust off of them as well. And of course, as normal, when you're taping, doing your indicator tape on your packs, you always want to make sure to label it with the date, with your initials, control lot number if applicable. And be aware that the shelf life varies with the type of pack that you're packing. There's a really great chart in your chapter 9 that talks about how long are packs good for, packs versus pouches versus gowns versus instruments, and how long do they really stay sterile after the autoclave procedure. Certain items are good for, 3 months, others are 6 months, others are good for up to a year. So please refer to that chart. Again, it's in your chapter 9 e-textbook. So make sure that you're reading through that. I don't exactly remember the exact page that it's on. I just know that it's there and it's really great information, especially when it comes to how long is that pack, that shelf life good for. If it passes the shelf life, we just would then re-sterilize the pack. We would retape it and then just put it right through the autoclave again. We don't need to rewrap it or reclean it or anything like that. We just have to re-sterilize it. Going into our next subject, getting away from sterilizing our items, we are now going to look at surgical terminology. Now, on our first day of class, we talked quite a bit about different surgeries, especially as we went over the list of surgeries that students can choose from. So before we look at kind of general procedures and considerations, I want to also highlight some terminology that's very important, which is incisions. Now, the reason why you need to know about these incisions is because you, as the assistant, are going to be the one prepping the patient. You're going to be the one shaving them, scrubbing them, and getting them all ready for that surgery. If you don't know where the incision is, you're not going to know where you need to clean and clip and get ready and prepped. So there's different types of abdominal incisions, there's different types of thoracic incisions. And remember, if you're ever in doubt, just ask the doctor. Ask them where they're going to be making their incision. You could even ask them how much room do they want with the shave job. Some doctors like to, have like 3 or 4 inch margins of hair gone. Others, they're a little bit more reserved. It's, again, a matter of preference a lot of the time here with our surgeries. So looking at abdominal incisions, there's a few main ones that you're going to see. The midline, the one that goes right down the middle of the patient, right on that ventral aspect, that is going to be the most common one that you're going to see, that midline incision. However, doctors could also do a paramedian, which is just right off of that midline. So either to the right or to the left, it's down one of those lateral sides. They may also use a paracostal incision, which runs on the lateral aspect of the thoracic cavity. So think of like where the ribs are ending off, right, on the rib cage. So it's kind of like right along where that last rib runs, right down below that thoracic cavity. There's also flank incisions, that are also looking at the lateral aspect again of that thoracic cavity. So just on another side of that. Again, the most common one you're going to see though is this midline. If they're going to go other places, usually the doctor will specify that and they'll let make sure to shave, 4-inch margins on the abdominal or shave up on the thoracic, or patient's going to be in dorsal recumbency or left or right side lateral. Those are all important things to clarify because that will also determine where it needs to be shaved and prepped and cleaned, for that procedure. Now, if they're doing a thoracic procedure, a procedure up in the chest region, we've got two main ones. There's, of course, another median incision. This is a sternotomy, again, going right down that midline. And then there's also one that you see here on the lateral aspect of your patient. This is a lateral intercostal thoracotomy used for very specific procedures. And we're going to look at a list of common surgical procedures throughout the next few slides here. You'll want to start to get acquainted with some of the names of these procedures, especially ones that are more common, right? Ones that you're going to see more often. Now, of course, the top two that you have listed on here, these are just all soft tissue procedures. And the next slide, we'll look at orthopedic procedures. So for soft tissue, some of the most common procedures that you're going to see performed is your standard spay or neuter. A spay is also known as an ovariohysterectomy. This is when we remove both ovaries and the uterus in our females. We also have a neuter, which is known as an orchiectomy. Neuter it's the same thing as castration. We tend to use the term castration when we're talking about large animals versus neutering for small animals, but it's the same exact thing. It's an orchiectomy, that's the surgical removal of both testicles. Again, those are both altering procedures for our males and females, and we do them commonly all the time, especially in small animal medicine with our dogs and cats. We're constantly spaying and neutering to prevent unwanted reproduction and homeless animals, of course. Now, let's look at some other surgeries. A laparotomy or a celiotomy, this is a procedure where a doctor will make a surgical incision into the abdominal cavity. Sometimes they're doing like an exploratory laparotomy, which means that they don't really know what's going on with the pet, but something's wrong. We need to take a look on the inside and try to determine what it is. So more of an exploratory based abdominal surgery. The next one here is a gastrotomy, and this is when the doctor creates an artificial external opening to the stomach. This is commonly done for bloat most commonly in bovine, which is our cattle. So bloat can happen quite often in ruminant animals. Ruminant animals have a compartmented stomach into 4 different compartments, and they produce a lot of methane gas. When they produce a lot of gas, it can get trapped in the stomach. It can cause the stomach to flip over on itself and cause a torsion. Whole myriad of things can happen. We can perform a gastrotomy to make an opening into the stomach to release that gas and air. And it's really quite common in in large animal procedures. In small animal, if the patient gets bloated, the stomach flips over, a torsion happens, and it gets bloated, a gastrotomy is not an option for small animals. What they'll do instead is for bloat is they'll go and do a gastropexy. This is when they make an incision into the abdomen, they flip the stomach back over, and then they actually will suture the stomach to the muscular sidewalls of the abdomen. This is called a surgical fixation to make sure that it stays in place and it doesn't flip over again, essentially preventing bloat from happening over once more. Bloat is really common in our large breed dogs. Think of like our deep chested dogs, like Rottweilers, pit bulls. Just think of those big, large breed dogs. We commonly see bloat. I've seen it actually in Great Danes more than any other breed. The next procedure on here is a splenectomy. An ectomy, when you see this surgical term here, ectomy means to surgically remove something. So you see how you see ectomy quite often, hysterectomy, orchiectomy, splenectomy. So again, we're removing some kind of organ, we're removing something. So spleen, talking about the spleen, ectomy, removing of it. So splenectomy is the removal of the spleen. Herniorrhaphy, this is a hernia repair. And we did go over hernias a little bit yesterday in our last section of our PowerPoint talking about umbilical hernias. They tend to be the most common one that we'll see. Um, whether that be large or small animal, I've actually seen it quite often in foals, which is baby horses. I've also seen it quite often in puppies. If an umbilical hernia happens, they're actually quite common, and we tend to correct them when they're under anesthesia for their spay or neuter. That's very common that we'll do it then. For horses, we don't commonly spay them, but we do castrate the males. So if it is a female, we can just do a quick sedated procedure to place in a mesh and to correct it. We like to do it when they're young. We don't like to wait to do hernia repairs. Again, they usually happen due to umbilical hernias. The next surgery on this list is an intestinal resection, also known as anastomosis. This is a surgical connection that's made between adjacent blood vessels, parts of the intestine, or other channels of the body. So, intestinal resection, this means that we're removing part of the intestine. There's many reasons why we might do this. Commonly, it's going to be due to a colic surgery, which is colic is just a general term for some kind of GI upset. In horses, we'll do colic surgery often. And we may need to resect a part of the intestine if there is a blockage. This also can be done for a foreign body removal surgery if you have a small animal, a dog or cat, and they ate something that they shouldn't have and it got stuck in the intestine. We also might be doing a resection there as well. So if something's stuck and it causes the blood flow to cut off and the organ starts to die, we want to resect and remove that portion of the dead organ. And then we will attach the two healthy ends of that intestine to each other. So essentially, you have your intestine, you'd be removing the part that's dead, necrotic, ready to be removed. So you're going to resect that part, and then you're going to take the two healthy ends and put them right together. Anastomosis, you're going to surgically place them together and suture those together. Most of the time it works, and patients don't really have much problems post-op, but of course, with any type of massive surgery like that, there can be complications. And urethrotomy, this is an incision of the urethra. The urethra is the muscular tubule that brings the urine from the bladder to the outside of the body. In our females, it's only about an inch or two long. It goes straight from the bladder right to the outside of the body, right below the anus. In our males, the urethra actually, it's much longer, it's much more narrow, and it goes up and down and around like an S curve, and it goes down through their penis all the way to the prepuce. So for our males, we talk about this quite a lot in Module 101, but for example, male cats are prone to getting blocked, which is when they accumulate crystals in their urine, the crystals build up and bound up and they block the urethra so they cannot urinate. And this is a medical emergency. If we do not perform surgery immediately and remove the blockage, the bladder can rupture and the patient can die. So we'll do a blocking procedure, which is placing a urinary catheter and flushing and trying to remove that blockage. If it's really bad, maybe we've had to unblock this cat multiple times and there's a lot of scar tissue. Sometimes they actually have to make an incision into the urethra to actually cut out the blockage. Sometimes they have to even resect the urethra. It's called a PU surgery, a perineal urethrostomy, and they will actually, I think it might be even be in the next slide, talking about more procedures. And it's when they actually will resect part of that urethra and reroute it pretty much taking that male urethra, cutting it really short, rerouting it to where it exits under the anus, where the female's routes theirs, and it can help prevent them from getting blocked again in the future. That's like worst case scenario. Worst case scenario. With blocked patients, we can put them on prescription food that breaks down the crystals and prevents them from forming, and it will prevent them from getting blocked ever again. So we don't like to go that surgical route if we don't have to. Yeah, it's actually on this next slide, the perineal urethrostomy. So that's that PU surgery I was just talking about. Um, so again, depending on how bad it is, it might just be doing a urethrotomy incision, removing it, or we might actually have to remove part of that urethra and reroute it. Now, some more soft tissue procedures that are common: cesarean section, also known as a C-section. This is used to deliver babies through an incision in the abdomen and into the uterus. So we'll do this for puppies and kittens. We even can perform cesarean sections on large animals like horses, cows, really any of your livestock, we can perform it on as well. It's a little bit different farm style medicine versus like in a nice clean hospital, but we can get it done. We don't go to cesarean section unless it's absolutely needed. It is considered an emergency surgery. We do not schedule cesarean sections unless the female has had issues in the past and they're going to be having another litter. Or, for example, I've seen this in large animal medicine with horses, where sometimes with race horses, they're breeding for size. And sometimes the babies are so big that when the mom tries to give birth, it actually, I've seen it happen with mares where it fractures their pelvis. And that's a really severe injury. I've also seen in French bulldogs where, because of the shape of their head, it makes it difficult for them to give birth, and that's known as dystocia, difficulty birthing. And we also have to result in a C-section because we don't want to suffocate and lose these puppies in the birth canal. So I've seen some situations where they may schedule a C-section if it's absolutely necessary, but it's not like human medicine where, what do they say? The stats are insane. It's like 1 out of 3 pregnancies result in a cesarean section in human medicine, which is just an astronomical amount. In vet med, you may see like 1 C-section every like few years. It's not common practice. It's not something you're going to see often unless there's a problem. The next procedure that's on here is a lateral ear resection. This is when we are removing part of the ear and we remodel it so that it's open to the air. Now, a lateral ear resection, I've seen this done commonly on dogs with floppy ears. So, for example, think of like your spaniel breeds, right? They have these big floppy ears that hang over their ear canal and they're fluffy, right? They've got a lot of floof and a lot of hair, and that's a recipe for disaster. When you've got really long, fluffy ears and they get wet, it traps the moisture inside of those ears and it can cause yeast infections or bacterial infections of the ear. Most spaniels will have chronic ear infections, and that's just due to their anatomy, unfortunately. Yes, owners can clean and dry the ears and try their best to keep them that way. Sometimes, though, it results in a lateral ear resection. If the owners just are having a really hard time with the ears, it's essentially like cropping of the ears, but you're taking off a massive portion of that ear flap. Um, Again, commonly seen in those dogs that have those big floppy ears that flop over, that could be harboring all of that bacteria and yeast. And unfortunately, dogs like that can have repeat or chronic ear infections, which means it just happens over and over and over. So an ear resection might actually be a really great option, especially if the owners are just unable to keep up with the kind of care that the pet needs. The next procedure on here is a cystotomy. This is a surgical incision into the urinary bladder. Usually they're doing this to remove bladder stones. Bladder stones are formed when there's an accumulation of crystals, and all the crystals will roll around and compress into each other and form into a stone. Stones usually have to be removed. Sometimes if they're small enough, they can be broken up by laser. But commonly by the time we catch it in animals, it's usually they're usually massive, and we do have to remove them surgically. A thoracotomy, this is a surgical incision into the chest wall. Of course, there's various reasons needing to do a thoracotomy, access to those organs. An enterotomy is a surgical opening into the intestine. Usually, an enterotomy is done when we are flushing out the intestine. Again, when there's some kind of blockage or sand or something that's present there that we need to flush out. They could also be doing an enterotomy for the colon, part of the large intestine, flushing out the colon. We do that a lot in colic surgery for our horses. Their colon is massive compared to our, even though they're monogastrics, just like our cats and dogs, their colon is much larger, substantially larger because they're grazers. And don't worry, if you don't exactly know what I'm talking about here, you will learn about this in Module 101 in Anatomy and Physiology. I'm going to teach you all about the digestive systems of these animals and the differences, and we'll go into quite a bit. The next procedure on here is a mastectomy. This is the removal of breast tissue, and this can be on the males or the females. Mastectomies are commonly done because of cancer. I've seen that, especially in females that are not spayed and they still have that the hormone production and all of that. That can influence, unfortunately, cancer from forming in those mammary glands and needing to be removed. Usually, if the female is spayed, we don't see mammary issues. It's usually only the ones that have the uterus and ovaries intact. And then we already talked about that PU surgery. Again, last case scenario, we don't jump towards this PU surgery unless we absolutely have to. And it's usually for male cats that have been chronically blocked over and over and over. They have too much scar tissue, and now we actually have to remove part of that urethra. All right. The next set of procedures we are looking at here are orthopedic procedures. So these are procedures that involve bone. Now, your general practice surgeons, or well, let me just rephrase that. Your general practice doctors can perform surgery, and they will perform like all of these soft tissue procedures. Most of these a general practice doctor can do or will feel comfortable doing. However, when it comes to anything orthopedic, this is going to be a board certified surgeon. This is going to be somebody who's gone to extra school, passed extra board examinations to become a licensed surgeon. It's a little confusing because you don't have to be a surgeon to do surgeries, but when it comes to more complex surgeries like joint surgeries, removal surgeries, even things like that PU surgery, that's an advanced procedure that more than likely a surgeon is going to be performing. So just be aware of that your general practice docs can do like general procedures, but when it comes to things that are more complicated, that's when you're looking at your board certified surgeons. Now, for orthopedic procedures, we've got some common ones that we'll do. I do want to touch on the onchiectomy. This is a declawing procedure. We don't perform these much at all anymore. The AVMA, the American Veterinary Medical Association, is actually looking at trying to ban declawing procedures as a cosmetic procedure because the healing time and just the overall quality of life is diminished post-procedure. So declawing, it might sound, as a really great option, right? Oh, you can remove the claws and then my cat won't scratch me. It won't scratch my furniture. It's perfect. But you have to consider how they actually remove the nails. They're not just taking the nails and yanking them out, you guys. To do a declaw procedure, standard is to actually take Roscoe blades, and they actually, if you look at your fingers, you guys, if you take a moment really quick and look at your fingers, do you see how your nail, it's like on its own little digit, how you've got that little 1 digit portion of the top of your finger that's got the nail on it, right? You've got actually 3 different sections of your finger, right? So the top portion has your nail. How they do the declaw is they actually just cut off the entire top portion that has the nail. So I want you to now think about having all of the fingers, all of your fingers, this very top portion completely removed and cut off. All of your fingers. And now I want you to learn how to like be a normal human after and do all of your normal things and not develop severe arthritis because of it. It is a terrible procedure. These cats are left with deformed paws. I mean, completely deformed. They develop really early onset arthritis. They have a really poor quality of life. A really big way that they release endorphins and also produce dopamine is scratching and having those play like attitudes. So be aware that declawing, that's a procedure of the past. We don't do it much anymore because it's cruelty. To be very open and honest with you, it's animal cruelty. It's terrible. The only reason that I would ever see a doctor removing a nail is if it was cancerous, right? Like the bone was cancerous, we had to remove that digit completely, or possibly maybe the animal got it stuck and like ripped out the nail and we need to do a procedure kind of to correct it or something like that. But when it comes down to a standard declaw, we don't perform those anymore. And most states, they're actually completely outlawed in. Not to mention, it's about $1,000 per paw. And then that's just talking about the procedure. I'm not talking about the aftercare, the medicines, and the lifelong care that you have to give that pet now that they're deformed. Yeah, it's terrible. And I will talk about it the way that it is meant to be talked about, which it is cruelty. It's not a good option. If you have a cat that likes to scratch, which they're going to naturally want to do, that's part of their instinctual behavior. Really quick, I want to show you guys. There's an alternative, and they're called soft paws. They're so cute. And they actually are little wraps that will cut the nails, and we put these little plastic wrap around the nail, and it's super cute. It looks like they have their little nails done, and it keeps it all soft. So that means if they go to scratch, it actually won't scratch into your furniture. They won't scratch you. They've got this coating on top of their nail. It's good for about 6 weeks. And then you'll just cut it off, remove it like normal, cut the nail, and put a new set on. And we use a glue to kind of glue these on as well. You can do them at home, but we also do them all the time in the veterinary clinic. So this is kind of the alternative to that declawing is using soft paws. Soft claws, soft paws, there's different brands and stuff. I know them as soft paws. And they're cheap. It's like $5 for like a set of 200 of them or something. So it's not like they're expensive by any means. Do they take extra time? Yes. Would you pay extra for your veterinary staff to put it on for you? Yes. But it can absolutely be worth it in the long run, especially if the cat is living with somebody that's elderly or has a bleeding issue where you're worried about them getting injured by the cat. This is a really great option. We will talk more about cat scratching and behaviors and how to prevent, how to mitigate that in Module 103, which is animal behavior. So we will talk about that more in that specific module. But remember, scratching it's an instinct. You're never going to out train a cat to do that. It's learning how to go around those things, learning the correct methods to use so that they're only scratching certain items and again, using what's out there so that our cats can have a full and great quality of life when we're not doing any procedures to mutilate them. Okay, with that being said, I could probably talk all day about declawing and how terrible it is, and I'm such an advocate for us to get rid of it completely, absolutely. But we'll move forward. Let's look at some other orthopedic procedures. So we have a intravebral disc fenestration. This is when the doctor will do a mechanical removal of the nucleus pulpus, which is to remove the rate of early and late reoccurrence of disc herniation in dogs affected by this condition. So dogs that have this disc fenestration, they are at a increased risk of having disc herniation and issues of the discs. So there's again procedures that we can do to kind of reduce it and to help it stop reoccurring and allow for healing time. They can also do intermedullary bone pinning. So this is when they actually will place the bone and screw or the plate and screws into the bone to hold it together after it breaks. So they can do this on a lot of the long bones. I'm talking about the femur, the humerus, the tibia, the fibula, the radius, the ulna, all of those long bones that you see in the limbs can be pinned through the intramedullary bone pinning procedure. They can also remove them at a later time. They don't have to. It really depends on the procedure, the pet, the activity level. In horses, they tend to remove the plates and screws. They actually will do a lot of joint corrective surgery on horses when they're young, like before 6 months of age, to correct their bones and how they're growing, and then they'll remove them at about the 1 year mark. It's pretty common, especially with racehorses. They do a lot of orthopedic procedures when they're young to make sure that their legs grow straight and strong as they're growing up. Another common orthopedic procedure that you're going to see is a femoral head ostectomy, an FHO. This is a surgical operation to remove the head and neck from the femur. So you can actually see an image of it here. So this on the left side, this is a normal femur into that hip socket, the acetabulum, holding right into there. On the right side, there is no femoral head. It's quite literally been sawed off. It was removed. This is an FHO. So they actually remove the femoral head and they suspend the femur in the muscle. Now, this might sound crazy. You might be wondering, how in the world does this dog use its legs after that? Well, actually, they can run and play and have normal physical activity after healing from an FHO. I've actually seen an FHO be done on both sides. So a bilateral FHO, and it's super cute. When these dogs, if they've had a bilateral FHO, the only way that you're going to be able to tell is when they go to like turn around really quickly because they don't have the femoral head into that socket to kind of keep the hips steady. They do this little like hula dance with their hips. It's really cute, you guys. And I'm not even joking. It's it's really adorable. They'll do this little like hula with the hips because they're not again set in place by those hip sockets anymore. So they're a little bit looser. They flow around a little bit more. But that being said, dogs can live long, healthy, great lives after an FHO, even bilateral FHOs. They're really resilient, these animals. It's quite incredible to watch. Okay, before we get into this next slide here, where we're going to talk about preoperative and postoperative considerations, we are going to go into a break. So I'm going to pause the recording now. Welcome back from the break, students. We're now going to get into preoperative and postoperative considerations. Today, we're mostly going to focus on preoperative, so preparing the patient but also preparing yourself, especially if you're going to be a sterile assistant, what that procedure is going to look like. So, as we've broken down previously through this lecture, there's kind of three main portions to surgery. There's the pre-surgical period, there's during the surgery, and there's post-surgical period after. So in the pre-surgical period, as we're preparing, we want to make sure that we're prepping the patient. We're also prepping the surgical instruments, prepping our equipment, prepping the surgery suite, and prepping ourselves. During surgery, we're going to be doing, depending on where your job is for that day, you could be monitoring anesthesia. You could also be sterilely scrubbed in as the surgical assistant, or you could be the non-sterile assistant known as like a scrub nurse to grab things for the doctor. Again, depending on where they want you or how many personnel are needed. Sometimes they don't need a sterile assistant at all. They just need somebody to run and grab supplies and be there to hand things off. Post-surgery, it's going to be waking up the patient from anesthesia, so monitoring and caring for the pet. We're going to be getting them ready to go home, printing out discharge instructions, prepping medications, scheduling them for the suture removal, which again is about 10 to 14 days post-procedure. And that's it in a nutshell. But let's break it down a little bit more in detail when it comes to the preoperative period. So, when it comes to preparing the operative site, I'm talking about preparing the patient for where the doctor is going to make their incision, right? So, we've got a few main things that we need to do. We need to, most importantly, prevent and reduce the likelihood of infection from happening. We do this by doing two different things. We're going to be removing the hair and shaving with surgical scrub and isopropyl alcohol. When it comes to hair removal, how much hair we remove will depend on the procedure. Standard is about 20 centimeters on each side of the incision. I like to think about it as like at least 4 inches around where that incision is going to be, should be completely shaved and clear. Some doctors will want more of a margin. Others, will be a little bit more conservative with how much hair that they shave. Again, it's really determined on that doctor, but it's always better to shave more hair than to shave not enough. Because if you don't shave enough, the doctor is going to have you undress the patient and do it all over again. Shave again, scrub again, and redrape them again. So again, much better to cut more than to cut less. You're always going to be clipping them with a number 40 clipper blade. A number 40 blade is one of the best blades to use because it gets you a really close to the skin shave. The initial cut, you'll do it with the grain of hair to cut off the bulk amount of hair first, and then with all the subsequent cuts, you'll go against the grain of the hair. And you'll get shown how to do this, of course, and get some examples of this as you're in lab. Now, if it's an area where we can't really shave the hair very well, sometimes that's like the inner portions of the back legs, so like the medium portions. Sometimes we can't clip very well, so we can use a depilatory cream, which basically just lays the hair down and keeps it in place. Because what we're trying to prevent here is from hair getting into that incision, and hair can harbor bacteria and germs and all of that. So we're trying to prevent any of that from happening. Now, we usually will shave them and prep them before we move them into the surgical suite. So we'll vacuum that, or we'll shave them, and then we usually use a handheld vacuum to vacuum up the hair. We can even use sticky rollers to kind of sticky roll off the prepped area of that patient before we go in and scrub. And then we technically like to scrub before going into the surgical suite. And sometimes we'll even do a second scrub when the patient's in the suite as well. Depending on the surgery, well, depending on how you prep it, there is if we're looking at like orthopedic procedures, you may be asked to do what's called a hang leg preparation for limb surgery. Unless you work with an orthopedic doctor, there's really no reason why you would be doing a preparation like this. This is for doing a procedure on the hind limb, either on focusing on like the knee or the hips. Could be looking at an FHO procedure. You could be looking at a TPLO. Many different orthopedic procedures are set up in a similar way to this. So it's basically just doing like a vet wrap bandage and looping some white tape up onto a fluid stand to keep it in this hanging position. And they will tell you, again, if that's what's necessary and that's how we have to prep it, we work together to then get it prepped that way. But again, most soft tissue general practice surgeries, you're prepping the abdomen or the chest or the thoracic region. After we're shaved and ready to go, ready to be scrubbed, we'll then go into a surgical scrub. We usually do this before we transport them into the surgical suite. So we'll do a general cleansing scrub with a germicidal soap. This is usually a chlorhexidine solution. It could be also a providine iodine. However, people tend to have allergies to providine iodine, so chlorhexidine is the hypoallergenic or allergy friendly version of this antimicrobial surgical scrub. So we tend to use chlorhexidine, and then we'll use a 70% isopropyl alcohol to wipe it off. We may also use a solution of chlorhexidine. They make scrubs and they make solutions. Solutions go on, it's a layer that's sprayed on right before the doctor makes their incision. And again, we like to do this to remove debris, reduce bacterial populations on the skin, and we'll do all of this before moving them into the surgery suite. This is known as like a dirty prep. They might have you do a clean prep too and scrub them once more in the surgical suite. And that's really just determined to your hospital and their procedures and protocols. You could do several scrubs before moving them into the table if they didn't want any done in the surgical suite. Rule of thumb is you'll do 3 scrubs and um, three alcohol wipes as well. So scrub, alcohol, scrub, alcohol, scrub, alcohol, and then ending with that solution right on top. Once we get them moved into the operating room, it's going to be positioning them correctly. So most of the time they'll be in dorsal recumbency, which is on their back, but they also might be in lateral, which is on their side, or possibly ventral, which is when they're laying on their belly. So confirming what's their positioning and making sure that we're positioning them correctly is very important. We'll place the patient on the surgical table. Most of these surgical tables are heating tables where we can plug them in and they actually will produce heat to keep our patient warm during surgery. If your hospital doesn't have something like that, they might just use like a water circulating heating pad. Those are common as well. When a patient's under anesthesia, they can lose body heat really quickly. One, because they're being filtered anesthetic air that is colder than normal because of the gas. And also, they're unable to regulate their temperature well while they're on these medications, while they're on these anesthetic drugs. So we want to keep them on constant warmers. We can even heat up fluid bags or socks filled with rice to help keep them warm and put them on the sides of their body. That's fine as well. We will secure them down onto the table with ropes. We can even use sandbags or even like V-troughs. We can technically use tape as well to tape down their limbs. There's many different types of prep. And again, it really just depends on what recumbency are they going to be in, what's the size of your patient, and using what is the best method for that pet. It can vary from patient to patient, even if the procedure is the same. Now, if the doctor is using electrocautery, which is your cautery tool, they will be placing a ground plate under the patient. Cautery is only usually used in a procedure where they're going into very vascular regions. We might be facing a lot of bleeding. So cautery, it'll cauterize those vessels and minimize bleeding. A lot of old school veterinarians use cautery still a lot. But not something you're going to see for general practice procedures, really only, again, for more vascular type areas. And then we will be attaching them to their anesthetic monitoring equipment. So attaching them to their anesthetic machine, putting all the leads, all the EKG leads on them, getting the temperature probe set up, blood pressure. We get them all connected and hooked up and ready to go to be monitored. Now, some hospitals will have you do a sterile skin prep. Others don't. Again, if you work for like an AHA accredited hospital, which is the American Animal Hospital Association, they usually require a sterile or a clean skin preparation inside of the surgical suite. That being said, not all hospitals require this. And again, it's really imperative to where are we operating. If it's an orthopedic procedure, then yes, we're definitely going to do a sterile scrub. But if it's just an abdominal, standard soft tissue procedure like a spay, we don't necessarily do a sterile scrub all the time. Again, this is dependent on your hospital, their procedures, but also the pet. How clean are they? If this is an indoor cat that never goes outside, that's very clean coming in the first place, we don't need to do multiple rounds of scrub. Versus like a dog that's outside all the time, or maybe they were hit by a car, right? And they're like covered in debris and dirt and things like that. Yeah, we're going to need to do way more scrubbing on a patient like that. So take it as case by case basis and trust your gut. Do what you think is best. And at the end of the day, follow your hospital procedure as well. Now, I am going to show you all a video about preparing an animal for surgery, kind of what that looks like, the scrubbing, moving them in, everything that we talked about to give you more of a visual of what that looks like when we apply it. So it's a quick 5-minute video here, preparing the surgical site using that aseptic technique, getting them moved in, hooked up to all of their equipment. So we will watch through this video to give you that visual, and then we'll get into our last subject, which is talking about prepping the surgical team. So prepping yourself and getting all gowned and gloved up if you're going to be a sterile assistant that day. Okay, we'll get into this video about prepping our patient right now.
I'm preparing Luda here for her ovarial hysterectomy using aseptic techniques. So we are on our surgical prep table right outside of the OR. So the first thing I want to do is I want to shave the appropriate amount of hair. So anatomically, I want to shave from the xiphoid process to the pubis and then laterally to the sides of the ribs. So I'm going to take my clipper. I have a number 40 blade, which is going to get me the closest shave to the skin. And I just want to shave all of the hair within that area and make sure that my lines are nice and straight and they're cosmetically appealing. I'm going to go ahead and shave her hair. Once enough hair has been shaved and my areas look good, I'm going to use a vacuum to suck up as much hair as possible. That way I'm not bringing any stray hairs into the OR.
Sorry guys, I don't know what happened with that screen there for that second. There we go. I don't know why that did that.
Alright, so there's no hair left over. I've got a nice, clean, straight line here. So I'm going to go ahead and do a dirty prep before moving her into the OR to do her final surgical scrub. So I'm just going to go ahead and put gloves on for this just to keep it as clean as possible. And for both preps, I have 2% chlorhexidine scrub and a 70% isopropyl alcohol rinse. So for the dirty scrub, I'm still going to try and just go down in a nice circular motion here. And do this one a little bit quicker than for the final scrub. Alright, so that's just my dirty prep. I'm going to go ahead and get my patient moved to the OR. My patient has been moved into the OR where I'm going to go ahead and do my final scrub before the surgery begins. So anytime coming into the OR, I want to make sure that I have my cap and mask on and that I have my exam gloves before touching the patient. So we did our dirty scrub. For my final scrub, I'm going to use also 2% chlorhexidine scrub followed with a 70% isopropyl alcohol rinse. And I want to do each at least a minimum of 3 times. Or until my sponges come clean. So for my final scrub, I'm going to use a target motion. So I'm going to go ahead and just take a sponge. I don't want to touch the underside, I'm going to touch the patient. I'm going to start at the incision site and just work in a counterclockwise motion out. Once I touch the hairline, I'm going to go ahead and throw away my sponge as I don't want to recontaminate the site. So, following my chlorhexidine, I'm going to take an alcohol sponge and with the same motion start at the incision site and work my way out. And at no point during the scrubbing do I want to go back over the incision site or anywhere that I've already scrubbed. So I'm gonna do that again. Incision site, circular motion and out. Repeat that with my alcohol, incision site, counterclockwise circular motion. And I'm just taking a quick peek at all of my sponges afterwards to make sure that they're coming up clean. All right, so this will be my last one. So I've got my chlorhexidine scrub. Start at the incision site, counterclockwise motion, and then without going back over, throw that away. I'm gonna do that one more time with my alcohol prep. All right, so that's my last one. It came off perfectly clean. If it were to be coming off dirty or anything like that, then I would continue with my chlorhexidine and alcohol rinse until it came back perfectly clean. But everything came back great. My patient is prepped, and we are ready to go ahead and begin her stay.
Your dog's been diagnosed as being hypothyroid.
Alrighty. Just wanted to play that next video right away. So that was surgical prep video for, oh, sorry guys, for preparing that.
In today's Spectral video,
Oh my gosh, YouTube. So that was it for that surgical preparation video, preparing that surgical site, getting it ready. I do apologize, the sound wasn't super loud when I was sharing it. It tends to be better if you just play it for yourself. Remember that these videos are linked under the videos and extra course materials section in the module, so please feel free. They're also linked in the PowerPoint too, so you can, if you download the PowerPoint, the links are also in those slides for you if you ever want to go back and rewatch those videos. Okay, we'll get started now with our last section for today. Our last subject that we will be addressing is preparing the surgical team. So we just talked about preparing your patient, right? Preparing the pet for surgery, but we also need to talk about preparing you and the doctor and whoever else is going to be working in that surgical suite. So if someone is sterilely scrubbing in, this is going to be your surgeon, and this could be the sterile assistant, which could be you if that's necessary. Sometimes they don't need a sterile assistant in all of the procedures. The surgical attire is going to be wearing dedicated surgical scrub clothes. These are usually in like that blue surgery color, kind of like that light blue color that's in the middle of this PowerPoint. Short sleeves is standard. If you're working at a general practice clinic, you always want to have an extra pair of scrubs in your locker or with you as you go to work, just in case you need to change into clean scrubs to do surgeries. I've worked at clinics where half the day I ran rooms and then the other half I was helping in surgery. And you'd never want to take your dirty scrubs that you've been wearing all day, you know, working with patients and all the hair and germs and everything on them, and then go into a clean and sterile environment. So you always want to have your clean scrubs that are set aside specifically for surgery and ready to be used if you are going to be assisting with that surgery. Now, if you're sterilely scrubbing in, you'll be doing a surgical scrub. This is a hand and arm scrub. This is to reduce transient bacteria. This is also to remove dirt and oil and reduce skin resident bacteria. And then you will be gowning and gloving up for your procedure. Now, people that aren't going to be sterile, you're still going to be wearing hair coverings, shoe coverings, gloves, and masks. Everyone wears those, but if you're scrubbing in, that's when you're then going to be wearing sterile gloves, sterile gowns, and being able to operate with that patient. Now, a little bit more on the hand scrubs. Again, we've got two different choices, either chlorhexidine, gluconate, or providine iodine. Chlorhexidine is probably going to be the one that you'll have the most contact with, again, just because it's that hypoallergenic. Now, when we do these surgical scrubs, these soaps, they are antimicrobial, they're rapid acting, they're broad spectrum, they're non-irritating. Again, they're to remove all of that transient bacteria and prep your hands before we're placing on those sterile gloves and our sterile equipment. Now, your lab instructors, they'll show you how to do this and you'll get the opportunity to do this as well. There are scrub methods. We use an anatomic timed scrub, so at least scrubbing your hands for at least 5 minutes. Some people say 5 minutes per hand. You should be setting a timer and scrubbing for that specified amount of time. You will also be counting the brush strokes. So you're going to be scrubbing with that. It's a special surgical sponge that you'll be using, and you'll want to count how many times you are scrubbing that surface area of the skin, and you'll do that for every single surface area. So like every single finger, I would count 1, 2, 3, 4, 5, move on to the next one. 1, 2, 3, 4, 5, on to the next one. You get the point. We want to be scrubbing from the tips of our fingers all the way down to our elbows. So it's in this entire portion of your forearm is what we're going to be scrubbing to prep it before placing on our gloves and gown. It's also important to note that you'll be removing all jewelry, so rings, bracelets, all of that will be removed. Also, this is something I'm sure your lab instructors have told you about. Fake nails are a really big no-no in the veterinary field. We do not use fake nails. One, because they harbor massive bacteria. They can harbor so much bacteria. They're actually, if you do a little research into them, it might deter you from ever getting them again. They are deemed really, again, harboring that bacteria, which is a risk to your patient, especially in a surgical environment. So nails aren't an acceptable thing in the veterinary field anyways. You should never have artificial nails on because with how we're holding our patients and scruffing them and doing procedures, they get in the way, they can cause harm, and they harbor bacteria. So they're not allowed in general at all. So keep that in mind. You can still have your nails painted. You can still have like gel on top of your nails, but when it comes to like acrylic or fake tips or long nails, those are a really big no-no. And they're not going to be allowed in a surgical environment and also just in the field in general. Rule of thumb is if you need your nails done for an event, you get them done, you go to your event and you take them off after. And that's just kind of the life of being in the veterinary field or any medical field for that matter. So short nails, no artificial nails. And once you're done scrubbing, you aren't to touch anything that's not sterile. So when I went over that video in the first few minutes of our lecture today, we looked at folding towels, right, for sterile towels. And that's going to be in a sterile towel and gown pack. When they open up that pack, it's going to be a sterile towel right up top, and they're going to use that sterile towel once they're done with their hand scrub. They're not just going to dry off with any paper towel or any regular towel. They're going to use the sterile towel that's in their towel and gown pack to dry their hands. Then they'll move forward, place their sterile gown, and then their sterile gloves. So once they do that scrub, they're only touching things that are sterile. Again, once they're done, they'll dry their hands and arms with that sterile towel. You start up at your hands and you work towards the elbow, like kind of like a blotting motion. Once you're done drying your hands, you're actually instructed just to drop your towel, whether that's on the ground or just put it on the table. Don't be walking it to the laundry bin and walking back because there's possible contamination risk while doing that. So just drop it. Whoever the surgery assistant is will come through and will clean it up after. That's part of their job. And then once they're all done with drying their hands, they're about to place their gloves and gown on. It's really important. You'll see doctors there, they're going to hold their hands like folded and up towards their body. They do that to make sure that they're not touching things and breaking that sterility. So they don't ever lower their hands below their waist. They're going to keep their hands higher up, usually folded together, again, to diminish the chance of contaminating that already clean hand scrub that they just did. So I do have a video that I want to show about the hand scrub, and then there is going to be another video that I'll show you all about putting on the gowns and the gloves. And that'll be after. So first, we're going to watch a quick video just about scrubbing in, how a doctor is going to scrub in for surgery. This is a quick little 2-minute long video. I do have a longer video that's about 15 minutes long. It's linked in the PowerPoint slides if you're curious on watching like a start to finish full procedure of the hand scrub. For today's purposes, I'm just going to be showing you kind of a snapshot video because again, you're going to learn how to do this in lab. You will get the time to do this in your laboratory setting. Okay, we'll go through this quick video here of a doctor doing their sterile hand scrub.
So we're going to start to scrub, and this is what surgeons have to go through on every case that we do here. For each one of our cases, we go ahead and open up a fresh scrub brush. We go ahead and try to make sure that things are really clean underneath our nails, making sure that we have nothing that's hidden under those nails at all. And if we do, try to get that taken care of. Okay, and then we'll go ahead and start to get our hands wet, get our brush wet. And the goal with this is actually to do 4 sides of every digit. We always want to keep our hands well above our elbows so water starts to drain down. And shift to the other hand, 4 sides to every digit. And then we're going to go ahead and get our brush wet again. Go ahead and start to scrub on our hands and our palms. Shifting back hand to hand and always keeping my hands well above my elbows. And then we start to go down our arms, again 4 sides. So we're doing that 4 times for every one of our surgeries. Our final scrub, we go ahead and rinse off, making sure that our hands are always above our elbows, things are dripping down, and we're ready to glove up.
Okay, so a great little snapshot video of the doing that hand scrub, prepping that to then go into our gowning and gloving. So this will be our last topic of today, is talking about now putting on the gown and then placing on those sterile gloves. So the gown, the surgical gown, is a barrier between the skin of the personnel and the patient. So again, it's that sterile barrier between us and the patient that we're working with. The doctors and the sterile scrub assistant will don their gowns away from the surgical table and the patient. So there's going to be a separate prep area where they're going to do their hand scrub and where they're going to place their gowns and put on their gloves before they go into that surgical suite. As I showed you in those videos earlier, it's really important that we're properly folding these gowns and towels so that they're easy for the doctors to pick up and lift right out and be able to dry their hands and put the gowns directly on. If we're doing this incorrectly, they're not going to be able to put their gowns on efficiently and possibly contaminate them. So folding it correctly is essential. Now, when the doctor puts on their gown, they will need somebody to tie them into their gown. So whoever the scrub assistant is who's not sterilely scrubbing in, basically like the dirty assistant, they will be the one that's actually going to help put on that gown and help tie in those ties for that doctor without touching any other portions of that gown. So it's just going to help them get all situated and fit in. Once the doctor has their gown on, then they'll go over and do the gloving. Now, we use sterile latex rubber gloves. That being said, just because we wear sterile gloves doesn't mean that that's a substitute for proper scrubbing. We still have to do the proper hand scrub. The reason why is because these are just gloves. They're not foolproof. It is very possible that these gloves can break, right? Or get cut into. And now all of a sudden, your fingers are touching the patient, right? And if your hands were not cleaned and scrubbed down before they went into those gloves, you're introducing all of that bacteria on your hand into the patient, which is going to cause an intragenic infection. So that's why we do those hand scrubs before, is because if something happens where the glove breaks or gets cut and now there's an opening, your hands are super clean underneath those gloves. Now, there's a few different gloving methods. There's closed gloving, there's open gloving, and there's assisted gloving. Closed gloving is when the hand never comes in contact with the outside of the gown or glove. This is more than likely the method that you're going to be using. Open gloving is when you're actually going to be touching it when the hands have already been scrubbed and good to go. I still like to do a closed method if I can, just because it's better to touch it with the sterile gown than with your hands, even if they've been scrubbed. That's just preference. And you may be participating in assisted gloving. This is when you're going to help your doctor put on their gloves, especially if they have to have multiple pairs of gloves, which is usually essential for things like colic surgery, exploratory surgeries. And there's various reasons why a doctor might want to double glove. Some of that is preference as well. So I am going to show you one last video for today. This is going to be the last material that we go over. And this is a video about donning the surgical gown and doing a closed gloving method. Again, the closed is the most common one that you're going to do versus opening or assisting. Okay, so we'll get started with this, and then that will be wrapped up for today's section.
Now I'm ready to don my surgical gown. I'm going to pick up the surgical gown, being careful not to touch the front of the gown or the sterile field. Step away from the surgical table, and I'm going to shake this gown out. Now, if these gowns are properly folded, you're touching the inside of the gown. So now I'm going to put my arms in the sleeve, and importantly, with closed gloving, you'll notice that my hands are not extended to the cuff of the gown. The closed gloving. Now, since my field is sterile, my cuffs are sterile, the glove pack is sterile, I can open it without fear of contamination. Now, if I open the glove pack correct side, so the right is on my right side, I've got to take the glove and put it thumb to thumb, like that. Okay, so I got my right glove, my right thumb to my right thumb. Now I do something a little bit different. I open my glove packs like upside down. And so now my left glove is on my right side. I just grab the glove right there, and it's already thumb to thumb. So left glove, thumb to thumb. What I'm going to do now is, without touching the glove with my hand, I'm going to roll that cuff over and completely enclose the cuff part of my gown. Okay? And then I'm going to sneak my hand into that glove. Just like that. Okay. And then I can do the same thing here. Grab that thumb because it's already thumb to thumb. Flip it over. Completely encircle the cuff. And I'm ready to adjust my glove. That's the closed gloving technique. That's the technique we use most commonly here at New Bolton Center. Obviously, it requires a gown. It requires a sterile field to complete, unlike open gloving. Since some surgeries are long, you want to make sure that you have the proper size glove, and the fact that you want to make sure your gloves fit properly and are adjusted properly. Now I'm going to use this sterile card. I'll hand this to a non-sterile surgeon. And this way, theoretically, now my back is sterile. However, you never want to count on the fact that your back is sterile. This is a good design for a gown, but the problem is that here to say here is likely to be sterile. Anything peripheral to there is not. And so if I'm waiting for something during surgery, I'll just cross my hands. I'll sometimes grab my gown like this to take a little weight off my hands. But consider from about belt height to mid-chest sterile, nothing above, nothing below, nothing behind, even though we have a sterile back down.
All right, so that is it for our section today. We've made it all the way to slide 65. So that is it for the section for chapter 9 today. I'm going to stop the recording here.